this from the incredible folks at Blacklock's Reporter just this morning. The Commons yesterday, by a vote of 209 to 113, upheld Cabinet's, quote, safe supply drug policy. The vote followed federal decriminalization of simple possession of cocaine, opioids, and methamphetamine in British Columbia. This is not about encouraging drug use or turning a blind eye to the consequences, Addiction Minister Carolyn Bennett said in Commons debate on the motion. Really? Because it feels like you're encouraging it, and I'm not sure why we have an addictions minister anyway, if we're not dealing with addictions, but rather enabling it. Anyways, I'll shut up. Let's go on. It is about acknowledging the reality that people will continue to use drugs, and that by providing a safer alternative, we can minimize the harm and pave the way toward recovery. But I'll get into that, because that actually hasn't happened anywhere that they provide a safer alternative. Opposition leader Pierre Poilievre sponsored the motion asking that Cabinet immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction treatment and recovery programs. Spending since 2017 totaled over $800 million, Pierre Poilievre told the Commons. In contrast, Alberta, from the very beginning of Jason Kenney's tenure, and much to his credit, chose a different way forward than many jurisdictions, not just here in Canada, but also around the world. We've even changed how we talk about the opioid crisis and treatment here in Alberta. We don't really use terms like safe supply because it's not true. There's no safe supply of injectable or smokable poison for which to slowly kill yourself. We don't use words like harm reduction to describe government-funded drug dens with state-issued fatal toxins handed to you by some government employee. In fact, we don't really use the word harm reduction at all anymore. I like the word that Alberta's public safety minister uses instead. He calls it palliative care. You know, I've never heard the government enabling of the slow, agonizing suicide of the victim of drug use as palliative care, but I think it's accurate. It really is. There's no way out of drug addiction except for getting clean or dying. That's it. And the government and those around you can help you do one or the other. In Alberta, we've chosen life, not just for the addict by opening up thousands of drug treatment beds, but we've also chosen life and hope and freedom from addiction for the families of the addicts who suffer alongside the addicted in 1,000 different and small ways. You know, there's one thing that came out of the leaders' debate that truly revealed the dishonesty of the NDP, who literally, right now, even still, won't shut up about Danielle Smith allegedly making Albertans pay for health care in all the NDP's dishonest and thankfully failed attack ads. Remember this ad?
So my friends, if I am your premier, we will stop these attacks on our public health care, and instead we will get to work on fixing it. We won't privatize it, we'll strengthen it. We won't fight with doctors, we'll recruit doctors. We won't cut diabetes pumps, we'll fund them. We won't blame Albertans with cancer or heart conditions, we'll make sure they get treatment and care. We won't make seniors pay more for medical exams. We'll cover more of their medications and, yes, their vaccinations, because we believe in science and evidence, not conspiracies. And, my friends, we will not make women pay for reproductive health care. We'll cover the cost of contraception for free.
I'm a very careful political watcher because it's my job, but it's also something I'm really interested in. And I'm also someone who pays very close attention to the addiction crisis. And let me tell you, I had no idea that the NDP had been charging the most vulnerable Albertans and those trying to get clean $40 a day for a treatment bed. It came out in the debate. Look at this.
You know, one thing I'm so proud about with our UCP record is it's what's being known as the Alberta model for a recovery-oriented system of care. Because we know policing is only one side of the story. The other is getting people the help that they need. And my chief of staff is one of the foremost experts on the recovery-oriented system of care. We got rid of the $40 per day user fee that Ms. Notley charged. We've added 10,000 treatment beds. We're building recovery communities, some in conjunction with First Nations partners, and we are going to make sure that every single person who wants addiction treatment has access to a treatment bed. Those two things have to go together.
It's true. The NDP was charging people with nothing, the most desperate amongst us and their families, $40 a day for life-saving treatment, while flat out lying about the intentions of the UCP for our healthcare system. But not only is what the UCP doing with drug treatment the moral thing to do by recognizing the dignity and potential of the individual and alleviating the suffering of the addict and their families, it's the effective thing to do if you actually care about what the left says they do. Overdose deaths. The left says we have to give addicts a, quote, safe supply of drugs. Otherwise, they're going to get dirty drugs and then die. So we'd rather keep them alive and suffering on our drugs than have them die on their own. That's the theory anyway. Though we do have now 30 years, so about 1.5 generations of suffering on the downtown east side, the Vancouver testing ground for these bad ideas, where society's forgotten people are used as guinea pigs for these societal experiments, which proves that safe supply has zero impact on overdose deaths, and it might even have a negative outcome. Alberta's got early data proving that our approach is saving lives. Look at this. It's by Michael Schellenberger in the National Post, comparing one approach from one province to another completely different approach in another province. All indications are that Alberta is getting it right. From 2021 to 2022, overdose deaths in the province dropped by 17%. In the same period, British Columbia saw a 1.4% reduction. In January 2023, the latest month for which data is available in Alberta, overdose deaths dropped to 111 from 172 in the same period last year. In April this year, BC counted 206 overdose deaths, a 17% increase over April 2022. Should Alberta continue on its recovery-focused path, we should expect to see overdose deaths drop drastically, while many more people with addiction find their path to a better life in recovery. Friends, it's my hope that other jurisdictions in North America plagued by this apocalyptic pandemic of death, crime, and human misery caused by opioids follow the Alberta example. It works, and the numbers don't lie, and lives depend on it. And one of those things that makes Alberta great and different is how we treat our people. We treat them like human beings, and I hope that never changes.
That was an excerpt from the Ezra Levant show. I'm Ezra Levant. Every weekday, I do a monologue about the topic of the day. Then I interview a fascinating guest either in studio or via Skype. And then I read your mail, whether it's fan mail or hate mail, which is sometimes even more interesting. This is on our premium service, though, called Rebel News Plus. Go to rebelnewsplus.com. It's $8 a month or less if you buy a whole year in advance. You get my show every weeknight, plus Sheila Gunn Reid's show every week. It's called The Gun Show. It's pretty amazing. You know, we rely on you because we do not take a dime from the government. In Canada, that makes us almost unique. So please help us out and help yourself to some great journalism at rebelnewsplus.com.